Hi, Nicola. It's lovely to see you again. I'm delighted to have you here with me today. Obviously, we've known each other for a long time, and I know you've just launched a new app called Myra, which I believe is going to hopefully transform some of the things that are going on with the NHS. I'm very passionate about the NHS, as I think a lot of people are, and anything that we can do to help develop more software, provide AI or whatever it might be to actually improve lives, I think is really important. And I'm very excited based on the conversations we've already had about what you're actually doing. So I've got some questions I want to ask you about it. I'm going to push this out to lots of people afterwards and hopefully get other people seeing what you're doing. And just really gives you a bit of a platform really to just see what other people think. So tell us a bit about yourself and what you're doing.
Brilliant. Thanks so much, Vince, and huge thank you to PhariWeb as well. Myra came about. Myra stands for My Resources App, and it came about really as a fusion from my life of working in the pharmaceutical industry, where I was founder and CEO of Flex Global, where we brought together clinical trial information and brought down some of the silos. And everybody knows that across health and social care, information is held in silos and is often, particularly when it comes to care, fragmented and information difficult to find. I was also a parent carer for 28 years, and that's been a huge influencer and part of the development of Myra, and also a carer to my elderly parents. Very briefly, I got together with a team of experts from the care and also the pharmaceutical industry, and we then went out and asked a lot of people. We did a lot of stakeholder engagement work, whether the problems that I'd encountered as a parent carer were the same as the problems that they had, and they were. We were lucky to get a couple of Innovate grants as well, and with that we did some stakeholder work, which allowed us to take from our MVP that we'd developed one piece which was the resources piece, and we then learned that there are up to 30,000 people a day, can you believe, who no longer meet the criteria to reside in hospital, who are in hospital because of the delays in putting in the care and the equipment that they need to leave hospital. So we focused things on the resources app called Myra, and we launched that this spring. And it's just going crazy.
Yeah, and as I said, I'm fully aware of what it's like when you get stuck in that situation, and it's heartbreaking and frustrating, and it doesn't do the NHS any good as well. Because I think we worked out over a period of a year, it's a saving about £4.4 billion to keep those people out. If you could, even if you could halve it, even if you could take 10% off, it's a huge saving. So great, let's go with it. Okay, so why does Myra exist then? Give us a little bit more around that.
Well, you just mentioned savings there, Vince, and there are absolutely, we can touch on that a bit later on. Again, I can give you some more stats if you like, but there are massive savings to be made, not only for the NHS but also in social care to bring forward the care planning processes to streamline it better than it is now, to join up the dots, particularly as more and more digital products are coming on the market. But Myra exists as well, for the patient, for the people, because if every day spent in hospital, it takes you a week more to recover, and you're very likely to get an infection. That's not quite right. Not likely to get an infection in hospital, but you can pick up infections in hospital. So it's better to get home. And that there are, as we've said already, many delays because the dots just aren't joined up, and the people struggle to navigate that complex web of local and national information that is available. So what we've done is bring together local and national information for people to be able to really quickly and easily access that, and then to be able to have information at their fingertips so that they know where to go, what to do, who to talk to, etc.
Okay, so what would family members normally do then? And when I say family members, I'm probably talking about carers as well, or anyone that cares about anyone that's in a situation like that.
Well, the current situation is that, you may get a family member who gets a call even from the hospital to say, can you come and pick mum up? And all of a sudden, as a family member, you're thrown into the position of having to find a taxi that takes a wheelchair, a carer, a specialist commode chair, whatever it happens to be, because your mum or dad, they're in a different position now to how they were before they went into hospital. And also navigating the financial side, whether you pay, whether the council pays, how does that all work? It's huge, what you have to deal with.
Okay.
And Myra supports you on that journey all the way through.
Yeah, and as I said, from my own personal experience, you spend hours trying to sort these things out, going backwards and forwards, and some people know what they're talking about and some people don't, and it's just the nature of the beast, unfortunately. So explain to us how Myra can actually help support caregivers generally. What does it do? What sort of resources are on there that can actually speed this up?
There are quite a lot of different categories, from, as I said, financial. It points you in the right direction, gives you information on finances, diet even, and where you can get meals, carers, care companies you can readily access. It has a legal as well. It has quite a wide range of functionality in it. For example, if you need to apply even for a blue badge, you can quickly access the information on a blue badge, and then at a click of a button go through to the government website where you can set about getting your blue badge. So I just urge people, it's free to download. It collects no data. Go and have a look yourselves. Download it, have a look at the app, keep it on your home screen. You never know when you're going to use it, or just, any person, any elderly person or any person with a long-term condition, the app is useful for.
Yeah, I mean, the thing I liked about it when I saw the example and downloaded it onto my own phone is the simplicity, because if you make it too complicated, and there's a lot of information on there that you just basically, through a normal sort of route, get to the right information. So I was actually delighted with that as well. That was good.
Yes.
So is there a real life example of Myra, of what you're actually doing? Is it, officially out there now, people finding it, etc.?
Absolutely. We've launched it in the south. That's only to start with. We've got it in the south at the moment, which the Isle of Wight has been our test bed, which is where we've done a lot of stakeholder engagement work as well with the NHS and social care providers. It's been launched on the island, and it's also been launched in Portsmouth and Southampton. We will be launching it to the Winchester area by Christmas time, and then it'll be rolled out across the whole of the UK following that. It will go very quickly, I think, now because of the need for it, but also because we're very ready to do that, to expand it.
Okay.
Yeah.
Okay, and then I suppose really, I mean, you mentioned earlier about the difference in NHS. It's great helping people, but financially, what's it actually doing for the NHS? What difference can the app make to them?
Well, I said to you earlier that maybe we talk a few more numbers in that respect. The unit cost per day to the NHS in hospital beds, I think, for elective surgery is over £2,000, for non-elective £1,000, critical care nearly £2,000, etc. The impact of having, you're not really mentioned the word bed blocking, but we all know what that means. People stuck in hospital when they should be going home if the process worked a little bit smoother. 13,000 people. There's a net impact cost of around £6 million a day. We worked out, didn't we? and that's an annual cost of £2.2 billion. I mean, it's extraordinary.
Yeah. You've got to get people out quicker and more succinctly, with all the services to support them. I remember times with my mother-in-law, and this is only recently, so I've got really recent experience of it. She was stuck in for, 8 days.
Yeah.
Longer than she should have been, just because we couldn't get the carers back in. That was crazy.
Yeah.
So,
I mean, 8 days up to 2 weeks is not uncommon.
Yeah, no, it's crazy. And clearing those beds is really important. So, other than quick discharges, what are the other potential benefits to the patients and families that get the app?
Well, we're putting quite a few nice benefits. People can get offers and discounts on products and services from within the app. They can purchase products through the app that they then get a discount on. We've also got entertainment. We've got Care Radio, which offers a community of care. We will be putting Sudoku and some games in it, and it also is a bit of an information hub. For example, the analog switchover. A lot of people aren't aware that all the copper lead. I don't know if that's the right way to put it, Vince, but you know what I mean.
All the wires, basically.
All the wires.
Yeah.
Yeah, that are now out of date are going to be switched off, and there are still a number of people out there with fall alarms, etc., that use those lines. So the likes of BT need to get their message out to the cohort of people that we're marketing Myra to. Well, not marketing, we're not selling it, but we're promoting Myra to. So we're able to convey some really important key messages from companies that need to get that information to this cohort of people. So it's actually a hub that brings together the community of care and enables that important messaging to take place.
Okay, and I suppose there's going to be a lot of pharma companies, medical providers, etc., that are looking at this. Are there any benefits for them? Because I know you were talking about potentially putting links on there for things like patients that want to go on to clinical trials, that type of thing, especially in this age group. What have you done around that?
Yeah, there's talks are in early stages, but if anybody's interested in talking to us, any companies out there that would like what we're doing and would like to talk about this, we are discussing with people, for example, the possibility of recruiting older adults into clinical trials via the app, and there are many ways that the medical profession can support us by becoming commercial partners. So very open to talking to anybody who's interested in that.
Yeah, because it's quite a big thing, isn't it? So I suppose finally then, let's just sort of put it out to everybody out there. The app's very simple to use. It's for patients, carers, anyone supporting someone that we're trying to get out of the hospital environment as quickly as possible. To help them have a better life, quite simply, and also to help the NHS as well by saving, huge amounts of money if we can get those, bed blockers. Should we use that word loosely? Because of the situation, because of admin, whatever it is, let's get them out. And then I really like it. I'm going to be pushing it and supporting it, and hopefully give you as much help as I can. So, what are the key features of the Myra app? Just give us a quick rundown so people can go and have a look at it, and we'll get. Well,
I'll give you a quick half dozen, but as I say, I do urge people to go, and it doesn't collect data. It's free to download. It's very, very easy to have a look yourselves. But it acts as a central resource hub, and as we've already discussed, it facilitates hospital discharge. It also can reduce readmission risk through educational support. And as I've mentioned, I think already, it's a really good information guide, and it supports caregivers and the person they're caring for. And as talking about the wellness side of it, it promotes self-care, which we're very passionate about, and staying well at home.
Well, thanks for that. I mean, I think. Yeah, I mean, I know it does a lot more than that because I was playing with it for about an hour or so just seeing what it does and seeing where the links went. And I think there's lots of more social interaction you can do around that as well. But it's a fantastic app. Let's hope lots more people come in, have a look, see what they think. I don't often promote things like this, but I'm absolutely passionate and absolutely keen to support you on it. So well done, and we'll try and get this out within the next couple of days, and see if we can get support, or at least make people more aware of it, because you never know when you might need it. So thanks, Nicola, and thanks for all that you've done, because you've worked on this, I know, for about 3 years, and it's a long, hard slog sometimes, but you get in there. That's the main thing.
Vince, you're amazing. Thank you ever so much, and thanks again to PhariWeb. Thank you.
No problem at all. Talk to you soon.